On the sidelines of the World Economic Forum, which took place at the end of January in Davos, Switzerland, Oxfam announced a report related to inequality and public services. The Public Good or Private Wealth report shows the growing gap between the rich and the poor that is destroying the fight against poverty, causing losses to the economy, as well as triggering a wave of inequality across the globe. The report said that the number of billionaires doubled since the financial crisis 10 years ago. From 2017 to 2018, there was a new billionaire every 2 days. Meanwhile, public services are not properly invested. In many countries, a good educational environment or healthcare service has become a luxury concept that only wealthy people can afford. Every day, 10,000 people die because they do not have access to health services that they cannot afford. The report shows that when public services are distracted, women and girls suffer the most consequences. This means that if public services are not appropriately invested, the world will face prolonged inequality, which makes it difficult to sustain socio-economic development.
Greetings from Việt Nam on VTC10's. Recently, Oxfam has released a report on inequality and the relationship between inequality and the public services. So what are the messages that Oxfam would like to send to Vietnam? In today's show, we have a conversation with Mr. Lawson, the head of the Inequality Policy of Oxfam on this topic. Thank you for joining our program today. The first question is, as far as I know, Oxfam has released a report on inequality. So can you share more with us about this report?
Sure. Oxfam is saying that the gap between rich and poor is becoming bigger and bigger in many countries around the world, and that this is very dangerous. So we have a situation where 26 people, just 26 billionaires, have the same wealth as the bottom 3.9 billion people, so the bottom 50% of the global population. So we have an extreme inequality emerging in the world. And Oxfam is saying this is very dangerous and it's something that needs to be tackled by governments.
From this report, what are the messages that Oxfam would like to send to Davos and also the government of Vietnam?
I think our message is that the growing gap between rich and poor is not in any way inevitable. It's a policy choice and it's a political choice. So we're calling on leaders at Davos and calling on the Vietnam government to put policies in place that will make society more equal, make it more fair, and reduce the gap between rich and poor. The report is an annual publication, and we always publish it in January, just before the meeting in Switzerland, in Davos. It's a joint effort. It has many people in Oxfam working on it, researchers, analysts, and also we have much help from outside experts. And the idea of the report each year is to focus on different aspects of the inequality problem, but always with the same message that the gap between rich and poor is dangerous, it's growing, and it must be tackled by governments.
Can you share with us about the relationship between inequality and the public services?
Inequality between rich and poor is not just about having a bigger car or a bigger house. In many countries, it's also about having the money to pay for much better education for your children or accessing private health care that means that you're much healthier or you're much less scared of becoming sick. So one of our messages this year is that it's not fair that your bank balance, how much money you have, should dictate whether you live or die or whether your children have the best opportunities and the best education. So our argument is that instead, the richer people should pay a fairer share of tax, and then you could invest in good quality free healthcare for all citizens and good quality free education for all citizens.
What is your assessment on the quality of the public services in Vietnam, including the education and health care service? And if possible, can you compare with other countries in the region?
Oxfam has done research on the perception of Vietnamese people of inequality, including health and education inequalities. And it's very interesting how there is a sense that both of these are growing. You know, in the past, you had good quality free healthcare for everyone. Now it's a situation where unless you have the right insurance, or perhaps you have to pay extra to doctors, or there's ways in which richer people can get better healthcare, and that's very unfair, and there's a sense that that's not right. Similarly with education, you know, children are working harder and harder, studying longer and longer, and money has to be found for uniforms, for extracurricular classes. Again, this means that those with money can support their children more than those without money. So I think you're beginning to see in Vietnam, despite good quality services and still some progress, that the gap between rich and poor is beginning to have an impact. And if you compare, for instance, to Thailand, where they have universal free healthcare, there's a big difference. You know, for everyone in Thailand, it doesn't matter whether you're rich or poor. If you get sick, you go to a government hospital of good quality and they will look after you. No reason why Vietnam could not have a similar system. And I think it would be very positive, and all Vietnamese citizens would be very happy.
Recently in Hanoi, Oxfam Vietnam organized a seminar to share the report, Public Good or Private Wealth. At the seminar, experts shared that Vietnam has recorded many impressive achievements in poverty reduction since the renovation in 1986. Since the 1990s, nearly 30 million people have officially exceeded Vietnam's poverty line. In the period of 2012-2016, the poverty rate increased significantly based on the criteria such as income, expenditure, and access to public services. However, increasing inequality is threatening current development efforts as well as the ability to achieve Vietnam's sustainable development goals.
Tình hình bất bình đẳng Việt Nam ấy, thì khi mà chúng ta chuyển sang kinh tế thị trường thì nó gia tăng lên. Thì nếu như là cái đây 10 năm thì chỉ số Gini, tức là đo lường bất bình đẳng, nó có độ 0,7, thì bây giờ nó đã tăng lên có độ 0,85. Bao giờ khi mà bắt đầu phát triển kinh tế thì có những người họ sẽ trở nên giàu có rất là nhanh chóng ấy, thì nó sẽ làm gia tăng cái bất bình đẳng. Tuy nhiên theo thời gian, khi mà các cái chính sách mà ví dụ như là phân phối lại chính sách về hỗ trợ xã hội ấy, được đẩy lên và mọi người đều có cơ hội tham gia vào cái tăng trưởng, thì bất bình đẳng nó sẽ giảm đi. Thế đối cả Việt Nam thì bất bình đẳng thì hiện nay có xu hướng tăng lên. Mặc dù là nó không phải tốc độ rất là nhanh mà có cái tốc độ xu hướng tăng lên như vậy. Thế thì để giảm cái bất bình đẳng đấy thì phải có một cái tăng trưởng sao cho tất cả mọi người, kể cả người thu nhập thấp và thu nhập trung bình cũng có thể hưởng lợi được.
Many studies around the world have confirmed the importance of providing public services, especially education and healthcare services, in narrowing inequalities and sustainable poverty reduction. According to experts, public services are an effective tool for balancing society, helping everyone, regardless of circumstances, regardless of assets or income, have an equal opportunity to approach a good life. Schools become places where rich and poor children make friends and where inequality barriers are removed. The medical facility becomes the place where the rich and the poor receive the best care, regardless of their ability to pay. The International Monetary Fund, IMF, also stated that public spending on health, education, and social protection is one of the most important tools for governments to reduce inequality and poverty.
In your opinion, what policies should Vietnam have in order to reduce the inequality and improve the quality of the public services?
I think the first thing to say is the Vietnamese government is doing many good things and is one of the more progressive governments in the world. But there's always more that governments can do, and it's always important to be vigilant. And as I said, there are increasing signs that within education and within health, that the importance of having money and how rich you are is beginning to have an impact on the chances that your children will have a good education and the medical care you get if you're sick. So we would be calling on the government to reverse that trend, to make the investments in public services like health and education, in government schools, in good government clinics. I think education and healthcare cost money, so any government needs a steady stream of revenue to ensure that every citizen has good healthcare. And tax is very important in that picture. If you look at the most successful countries, the really progressive countries that are both growing, but growing in a way that is equal, you see a much fairer taxation of the rich, and you see that investment in universal public services like health and education. So yes, that combination of fairer taxation and good quality health and education for everybody can make a very, very big difference to the gap between rich and poor, and it can make a society a much happier, safer, more cohesive place to live. And that's one of our messages for the Vietnam government, is to be thinking about a more human economy for Vietnam. So thinking about other aspects of life and people's safety, security, people's dreams for their children, and that investing in these kinds of things can make the whole of society better.
What is the role of the private sector in this regard?
Oxfam's view is that the private sector is very important in many sectors of the economy, but we do not think it has a strong role to play in health or education. Based on the evidence from countries around the world, the countries that have the best healthcare and the best education, it's almost all delivered through the public sector via the government, because the private sector, by definition, needs to make a profit, so they tend to focus on the richer people in society. So they're not very good at serving all citizens. They tend to be focused on the richer people and providing services for them. So whilst we think the private sector is very important to an economy for creating jobs, in healthcare, in education, the evidence shows that it should not really have a big role, that really it's the role for government to make sure that everybody is healthy and everyone gets good schooling.
What is the plan of Oxfam in supporting the Vietnamese government in dealing with inequality and also improving the quality of public services?
Well, Oxfam has a long history in Vietnam, and we've worked in many issues with the government, and we are working closely with the government on this issue of inequality. We know that people in the government are concerned about the growing gap between rich and poor in Vietnam, and certainly the sense on the part of many in the public that, you know, it's money or it's your connections that will give you progress, and it's not about hard work, and that needs to be changed. So I'm here in Vietnam visiting. I gave a presentation at the Academy of Social Sciences earlier in the week, getting Vietnam's government to think about new ways of keeping the progress going in Vietnam in a way that everybody benefits and not just a small group of rich people.
Once again, thank you for joining us and for your sharings today. And that's all we have for this episode of Sang Vietnam today. For comment and feedback, don't hesitate to write to us at sangvietnam@netvietv.net. Thank you for watching and goodbye for now.